very good day to you and warm welcome to Health Talk, your weekly dose of analysis of current health issues. We broadcast live from Johannesburg in South Africa. Health Talk is also on YouTube. Now, I'm your host, Dr. Sello Mutaulu. The focus of today's show is on HIV/AIDS in South Africa. You can be part of this discussion by calling us on Johannesburg 714-6843, 6847, or 6857. Before our topic for this week, we look at a current health story continuing to make headlines. Now, the Ebola epidemic is still gripping the West African region. If cases in the region continue to rise at the present rate, it is estimated that by the beginning of November 2014, more than 20,000 people in West Africa will have been infected. The entire world is urged to do more to help bring this pandemic to a halt. Health Minister Aaron Motsoaledi says the Ebola crisis in West Africa is a lesson to the rest of the world that healthcare systems need to be ready to combat things like this. He was speaking on the sidelines of the high-level meeting at the United Nations.
As the world ramps up its collective response, the view from South Africa is that everyone needs to do more in an era where health emergencies are likely to become more commonplace.
We've entered an era in the world where most of these pandemics will start happening because of movement to urban areas, urbanization, and many other changes that are taking place in the world. So the first lesson is that healthcare system needs to be strong so that whatever comes, they will be able to handle.
The UN chief says the virus is killing more than 200 people a day, 2/3 of which are women, the primary caregivers.
We should consider whether the world needs a standby corps of medical professionals backed by the expertise of WHO and the logistical capacity of the United Nations. Just as our troops in blue helmets help keep people safe, a corps in white coat could help keep people healthy.
It's a marathon, but you have to run it like a sprint. And that's only possible if everybody chips in, if every nation and every organization takes this seriously. Everybody here has to do more.
Almost 3,000 people have died, over 6,000 infected, with fears that hundreds of thousands could die if commitments don't immediately result in action on the ground. Sherwin Bryce-Pease, SABC News, New York.
Right. The Human Science Research Council, or HSRC, recently launched the 2012 South African National HIV Prevalence, Incidence and Behavior Survey report. Now, according to this report, approximately 6.4 million people in South Africa were living with HIV/AIDS in 2012. Meanwhile, the importance of HIV/AIDS education recently came under the spotlight during the Mpumalanga AIDS Council's Lekgotla. The aim of this meeting was to discuss strategies that play a significant role in the fight against HIV and AIDS. Following KwaZulu-Natal, Mpumalanga is the second province with the highest number of HIV-infected people. The Mpumalanga AIDS Council has attributed the growing HIV prevalence to high levels of poverty, unemployment, and inequality. Reverend Gordon Mthembu of the civil society says communities must work together to fight against HIV and AIDS. This is what he had to say.
We ought to not to stigmatize people, and families, they must support each other to take the medication accordingly and to do everything as being prescribed by the doctor or by the hospital, so that these people, they can take their drugs. And it's very important that they can stick and they must not abscond, because the other thing is those myths that we have in our communities, that if maybe you being prayed for oil, you being anointed by the oil, then the HIV will be gone. No, that's not true. People then, they start to abscond their tablets, and it's very important that people, they must take their medication.
All right. For a discussion on HIV and AIDS, we're joined by a very special guest, Professor Kangelani Zuma, who's the Executive Director and Head of Biostatistics at the HSRC. Professor Zuma, welcome to Health Talk.
Thank you. Good morning.
In my introduction, I said something about the research survey that you recently launched. Can we just perhaps go through the findings of this report? But maybe before that, let's start with this basic terminology so that people get things right. We talk of prevalence and we talk of incidence. What is the difference between the two?
Yes, thank you very much. These are two different figures, and the prevalence of a disease is what we call the burden of disease. That is, the proportion or the number of people who have a particular disease at a particular point in time. So that's the prevalence.
So it's like a snapshot of what's happening at the
Right
moment.
now.
Right.
Correct. Now, the incidence is among those people that do not have a disease, so that people who are negative, in case of HIV, those are people who are HIV negative. If we take them, for example, at the beginning of the year, and we keep testing them for HIV throughout the year, by the end of the year, how many of them would have become HIV positive? So that is the rate of new infections, and that is now the incidence of HIV.
Right.
In this case, that's the big difference between the two.
Okay. Then let's go through the main findings of your report then. It appears that the prevalence rates, or at least the prevalence, has increased over time.
Okay.
Can you give us an idea?
Right. The HIV prevalence has increased from 10.6 in 2008 to 12.2 in 2012 survey that we have done.
Yeah.
Now, we need to understand that increase in prevalence in context of what has been happening in the fight against HIV.
Right.
For example, the way HIV, when you look at it, people either die due to mortality, due to HIV, or HIV and AIDS, or people get infected with HIV.
Yeah.
Now, for us, when we look at the prevalence of HIV, it's these two factors that come into play. Now, this increase in HIV prevalence that we've seen, it could be due to the fact that people are now living with HIV longer because of antiretrovirals, which is a good thing that people live longer.
Just to put it in perspective, I mean, in simpler terms, you're saying that if the prevalence is increasing, let's say from 2005 to 2012. So if in 2005 a snapshot was taken of how many people have HIV, it was X. If the same snapshot is taken in 2012, there's now more people.
Yes.
So there's more people living with HIV in 2012 than there were in 2005, for instance. So what you're saying is there's reasons why we now find more people, that they're living longer.
One of them could be that people live longer because of antiretrovirals, so which means if those people were there in 2005 and they did not get maybe interventions like antiretrovirals, most likely they would have died.
Yeah.
Now that they're on ARVs, they live longer. When you do the survey again, you're most likely to find them.
Yeah.
Also, the other factor is that those that were negative in 2005, between 2005 and 2012, they could have still been infected, and that is now the incidence. So these are two contributing factors in this.
Okay.
Now, we need to understand that we've seen that there's an increase in HIV. Of course, a big part of it, more people on ARVs, people live longer. But also the worrying factor is that there is quite a considerable number of them that are due to new infections. That is, more people getting infected even at this stage of the epidemic.
Right. So let's have a picture of what the distribution is like throughout the country in provinces. I mentioned earlier that KwaZulu-Natal and Mpumalanga are the two provinces with the highest prevalence in HIV. Yeah.
Yes, the provincial distribution, it's correct. KwaZulu-Natal is still the highest, and Mpumalanga also following up. Western Cape is still the lowest with HIV prevalence, but of course there is also an increase in HIV prevalence from year to year in the Western Cape. And also, if you look by geography of where we are, people in urban informal settlements, the prevalence of HIV is quite higher in those areas, followed by the rural areas, the traditional tribal areas. The prevalence of HIV is also very high in those areas. Women still continue to be the ones carrying a highest branch of HIV. And of course, it's due to a number of reasons. Even our biological makeup, for example, is not because it's a women's problem. Everyone has a problem with HIV. By race also, black Africans still have the highest HIV prevalence compared to other races. And what is also worrying in terms of the HIV that we see is that the youth, for example, especially young girls, still have a very high prevalence of HIV. When I say young girls, 15 to 24 compared to the boys within the same age group.
All right, let's just hold it there because we need to just go for a quick ad break. And when we come back, we'll continue discussing, risky behavior and some of the reasons why, there's this increasing incidence, especially in the young ones. And we'll be joined by 2 other special guests. So please don't go away. And remember the number to call if you want to join this discussion. Johannesburg 714-6843-6847 or 6857. Stay with us. Yeah. Farid?
Yes.
Can you hear us now?
Morning, Salah.
Good morning.
Yes,
Good
very
morning.
well, thanks.
Sorry, we had some technical. We'll join with you just now. I don't know if you're able to see the discussion.
Yes, I followed all of it, thank you.
Okay.
And
All right.
I saw Kangelani looking very handsome there on television.
All right.
Hey, Farid, how are you?
Welcome back. You're watching Health Talk. Now, there's some behavior, especially amongst our youth, that is often regarded as being streetwise, cool, weathered, or having arrived. However, risky behavior is sadly associated with a high risk of infection with the HIV virus. Such behavior includes, among others, having multiple sex partners, vulnerable young girls dating older males for material gain, engaging in sexual activity at an early age. Take a look at this insight produced by Tembi Majombozi.
Today, hundreds of young people will be infected with HIV. It was the same yesterday and is likely to remain the same tomorrow. These young women are at a high risk of HIV infection. Today, more young women will be infected by older men. This is how it happens.
Let's say if you get it from like a shipping, obviously not gonna use a condom. You can say she's gonna say, "Hi, it's my first time." Okay, it's the first time. I'm gonna show you how to do it. They say, "Look at it." You're gonna look for the condom. You're pretending like you do have condoms in your room, but you don't even have it.
I don't want to lie to you. I never used condom. But when I wanted you, like almost like months and stuff like that.
You're hungry.
When I catch you,
I must
must I go look for condoms if I don't have in my room?
Most vulnerable are young women from informal settlements.
It's always younger people that you date because it's actually much easier to approach. And obviously the monetary value of things works better because you are the one who's a provider.
Many young women of all races and classes date older men for material gain. Instead, they lose their souls. Josie Kekowski used to date older men for money. She had this to say to us.
He came to me. He took me out. He bought me beautiful things. He got me this really pretty necklace, which I threw away after our arrangement ended. Anyways, he would pay me. He put money in my account, And I didn't have a bank account at this time, so it was like a PayPal. So I put money in my PayPal, and he basically like provided everything for me. Now the only thing that I didn't get, which I wanted but could not, hide, was a car. He was gonna buy me a Lexus, and I was gonna be like, oh my god, this would be so awesome to roll around in this. But I would not be able to explain that to my family.
Josie was not infected. She got tired of that life and quit.
There are girls who will be manipulated and pressured into doing things they don't feel comfortable with because of the money or the gifts that are exchanging hands. I know of girls who have consented to sex that they felt very uncomfortable with because they were already in a hotel room and they had already been given a necklace and they felt that they couldn't say no.
According to the UN AIDS, despite efforts like these to create public awareness about AIDS, accurate knowledge about this virus is still poor.
I am a girl who thought my friends wanted the life an older man could offer us. The cash, cell phones, and clothes. But when we spoke about our dreams and plans, we realized that the risk of getting HIV and sacrificing our future is not worth the bling and the flashy cars. We know if we look after ourselves and we're there for each other, anything is possible.
Government has made an effort to create awareness. How do we measure the impact of such adverts? But these older men date teenage girls and are frank about it.
I can say that I am a sugar daddy on a way that I do date some young girls at an early age of 18 years, 17 years, as I'm 30 years of age now. The thing is, I normally waste my money to those little ones who are like so many things, like nails, making them hairs, to buy expensive clothes. I make everything for them.
I've been dating a 15-year-old, but I never had sex with her. That's the thing. I only like when she's asking for me something I won't bought for her. I'm gonna just get a kiss. But when I'm drunk, I just say, okay, can you please come to my house? I said, no, my mommy's gonna do this and this.
This treatment action campaigner is troubled by intergenerational dating.
Intergenerational dating is quite a challenge for these young women because older men are taking advantage of these young girls in a sense that some of them, they come from a very poor background. So they don't have any say in these relationships. They don't even initiate condoms because these older men are giving them money to provide their younger siblings. They are buying them nice clothes. They are taking them out for dinners. So these young women are having a challenge in terms of saying no, but let us use a condom to these older men.
The Human Sciences Research Council's latest report on HIV prevalence among young people states that condom use has decreased. The trend of having multiple sex partners has increased in males and females between 15 and 24 years of age, a behavior that puts young people at risk. Teenage boys start as early as 15 years to engage in sex. They cite peer pressure, low self-esteem, pessimism, sexual coercion, transactional sex, exposure to TV programs and technology. Many TV soaps and radio programs glamorize having multiple sex partners as being cool, classy, and with it. Kerry Cullinan believes that the media could do more to educate the public, but the education has declined.
I think people need to be reminded continuously that there is such a thing as HIV, so the media needs to cover HIV, and we're not. I think people have the newspapers, TV, there's not much about HIV anymore. And it's going to be with us forever, for as long as we're alive, because the people that we know who are our age group, they're on HIV, they're on treatment. They're going to be side effects of ARVs, we're going to be seeing all those kinds of things. So HIV there's a lot that still needs to be covered about HIV, and I think we need to just keep on. reminding people. But also we need to remember that young people are growing up every day, and they were not exposed 5 years ago when there was a lot of media coverage to HIV education. They must continue to be exposed because they might not know how you get HIV, in fact.
The general public perception is that people who know how HIV is transmitted will change their behavior. After all the awareness, they have not changed. In 2011, the indication was that HIV incidence has gone down. Public education subsided. South Africa seems to be going to square one again. There is no sustainable awareness program.
Some chilling and worrying stuff indeed. Okay, we'll continue our discussion on HIV and AIDS with our guest here in Johannesburg, Professor Kangalani Zuma. But we joined from our Cape Town studio by another special guest, Dr. Farid Abdullah. Dr. Farid Abdullah is CEO of the South African National AIDS Council. Dr. Abdullah, welcome to Health Talk.
Thank you, Selo. Welcome and good morning.
All right. And we also have another special guest here in our Joburg studio, who's Mr. Sipho Resiba, who's the Chief Operations Officer from the Film and Publications Board. Mr. Resiba, welcome to Health Talk.
Thank you and good morning.
All right, gentlemen, we've seen some of the chilling clips, some of the statements made by some of these young people here, which really refers to risky behavior. Perhaps let me go back to you, Dr. Abdullah, to just invite some comment on you with regards risky behavior and HIV transmission in South Africa.
Well, Dr. Zuma's study has been very important for this country because it shows that risky behavior, risky sexual behavior is on the increase, and we have to do much more to tackle basic information and we have to have more programs, more education, more media, about multiple sexual partnerships, using condoms, and delaying sex until you're a bit older.
Mm-hmm. Maybe Professor Zuma, in terms of this study, you've reported that risky behavior seems to have gotten worse. Less condoms are used. There's more people with multiple sexual partners. What could be driving some of these behavior issues?
I think as highlighted in the clip that you played before, issues such as, for example, peer pressure, as I mentioned, for others, yes, but also is the lack of, publicity, promoting safe sex and also educating people about the risk of HIV infection, as we've been doing a couple of years ago, where we had the hype and educating and having billboards there and there. Mm-hmm. So the young ones, for example, 4 or 5 years ago, who were young, wouldn't have followed those issues in public, they are now teenagers. So actually they're not aware of this information. And this gap is what is actually leading to these challenges that we're having. Yeah. So we seem to have pulled our pedals back in terms of promoting safe sex, educating people about the risk of HIV infection, and we seem to have focused more on treatment, which is good, but also treatment alone cannot do everything that we need to actually fight the epidemic.
Right. Mr. Resiba, it is said that the media isn't doing enough to spread the message. And it's probably one of the reasons why we're seeing the increasing incidence. Now, one of the reasons, or one of the possible drivers of this behavior, people say, is the exposure, to young people of films, of adverts, of television programs that appear to be promoting risky behavior. Your comment from a Films and Publications Board's perspective.
No, that is correct. And in fact, as the Film and Publication Board, we do understand and recognize the fact that the media has a potential to be a powerful driver of social outcomes. Right. And that there is a link between exposure to behavior. So in 95% of the times, you'd find that adolescents and teens would shape their value systems around what they get exposed to in terms of media content and films, games and certain publications. But also, I think the rise of and the increase of social networking sites has also contributed significantly to some of the risky behaviors that we have come to know. And also, sex offenders and pedophiles, they use these platforms to lure their victims. I mean, in one of the inserts that you played, you'd see that some of this, there's older men who would really find sexual gratification by engaging in sexual activities with girls as young as 15.
Okay, so what's your role then as the Films and Publications Board, you know, to try and help the fight in that regard?
Firstly, what we do is we regulate the distribution and in fact the media and content distribution through classification, and ensuring that all people who intend to distribute this type of content in the Republic are registered with us. But we also do a lot of work in terms of public awareness and educating the kids out there in terms of the dangers of premature exposure to adult experiences through the media.
Okay. Look, I think there's a challenge to the media in general, and I guess to bodies like yourselves to do, in fact, a lot more than we'll be doing now to try and help keep this scourge. I'm afraid that's all the time we had for you, Mr. Receiver, and thank you very much for your contribution. Okay, that was Mr. Sipho Receiver, the COO of the Film and Publications Board. Okay. Now, when we return, we'll now look at some cultural practices that may pose a risk to HIV transmission. Please don't go away.
Yes, fine, thank you.
Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1.
She doesn't. The opposite way. She's unique.
Yeah.
Welcome back to Health Talk. Now, sub-Saharan Africa has the highest rate of HIV/AIDS infections in the world, and women are the most affected by this pandemic. Culture plays a significant role in people's lives in Africa as a whole. It is generally held that some cultural practices have helped to curb the disease. On the other hand, however, certain socio-cultural factors are believed to be responsible for the rapid spread of this disease. Take a look at this insert produced by Thando Nxumalo.
The role of culture has been particularly problematic in the fight against HIV and AIDS. When one talks of culture, especially in the context of HIV and AIDS, what comes to mind is the male-dominated society in which we live, as well as the gender inequalities which it has given rise to. Different cultural practices such as traditional circumcision and initiation into manhood, known as ulwaluko, which is an ancient ritual practice by the Xhosa people in South Africa, may expose people to the HIV virus. The World Health Organization says circumcision reduces the risk of one contracting HIV, but unhygienic methods used in male and female circumcision have not spared their victims. This is worsened by the use of contaminated instruments. Another risky cultural practice is ukungena. This happens when a man dies without a male heir. The widow will be married to one of her late husband's brothers in order to bear male children for continuation of the family lineage. These too can be a risk factor for contracting HIV. Other cultural practices such as having sex with an in-law, known as gulamota, have their roots in irrelevant historical social norms. Today, their continued practice in the context of HIV and AIDS is a threat. In cultures where virginity is a condition for marriage, girls may protect their virginity by engaging in unprotected anal sex. Girls do this to gain marriage. In such societies, marriages define a person. An unmarried woman gets a stigma. Family planning is never considered. Multiple sexual partners by a traditional man are an acceptable practice. It is counted as conquest. Prevailing traditional beliefs that men need sex with more than one woman to survive are a threat to healthy living. This can lead to HIV infections. Ukuthwala is a cultural practice tantamount to sexual intimidation. Teenage girls are forcibly married to older men. It is a prelude to infections. Customary home births are a familiar and customary way for some cultures to welcome a new life into their home state. The rise of home deliveries is quite alarming. Contaminated tools can transport germs and viruses. Transmission of the HIV virus from an infected mother to the baby under such circumstances may be a reality. Can culture be altered to modern times?
All right, we continue our discussion. We still have our guest in Cape Town, Dr. Farid Abdullah. In Johannesburg, we have Professor Zuma. And we're now joined by another special guest, Ms. Nokwezi Hoboi, who is the project coordinator for the National Teenage Pregnancy Prevention at the Sonke Gender Justice. Ms. Hoboi, welcome to Health Talk.
Thank you, Doctor.
We've shown clips about cultural practices and especially women. Let's just focus a little bit on women and get your perspective in terms of the risk that women face insofar as HIV transmission is concerned.
Thanks a lot, Doctor. Well, with the clips that have shown, especially with ukuthwala and ukungenwa, these are cultural traditions that have been there from ages ago. However, now in this state, they are done in an incorrect way, because ukuthwala was done in some cultures with the consent of the woman, and the woman would not engage in sexual intercourse without consenting to it. Families would be joined. However, now the way it is being done, and ukuthwala of younger girls, the marriage of teenage girls or adolescent girls, if we may call it. Yeah. Actually, it's true that it exposes the young girls to HIV infections.
But why is it not done in the correct way nowadays?
The miscommunication or the changing of the cultural knowledge or the conversations that we're having around culture, which is why now Sonke Gender Justice has got a lot of campaigns that are happening in rural areas, such as the One Man Can and the men care programs, the men as partners, and the work that we're doing on gender-based violence, educating around the prevention of teenage pregnancy, and a lot of engaging with the men, because men are seen as the perpetrators, or men are seen as the ones who infect women, and women become the ones who carry the burden of HIV and AIDS in our communities. What we should push more for is more information, more education around these cultures, these traditions, engage traditional leaders, engage men themselves, and how do we start engaging our young boys so that they grow in a way that protects the women within their society.
Okay. Let's cross over to Cape Town and invite Dr. Abdullah's comment. Dr. Abdullah, your comments?
Yeah, you know, we live in a country with the highest rate of HIV in the world, and that's going to affect every aspect of our social and cultural life. And really, you know, it's important that we discuss these things with traditional communities in a sensitive, in a respectful way. But the bottom line is that we have to deal with practices which expose people to HIV infection, so that we can, you know, make people come to the right conclusions about what has to be done with a range of social and cultural practices. I think that we also should keep it simple, and by that I mean encouraging the use of condoms, making condoms available, educating young women about how protective this can be, educating men that this is not only for the women but it's also for their own protection, and you know, sending clear messages about reducing the number of partners, staying with one partner at a time, delaying sex until you are older and ready for it. So these are the things that we need to focus more in this country. We need to do much more, and I think that we can go a long way in reducing the number of new infections, because at the moment it's unacceptably high, as the HSRC study has shown. Every year we now have 400,000 new infections. 1 in 4 of those are in young women. So we have a real crisis, and it does mean that we have to address both normal sexual relationships and practices, but also tackle some of the very complex traditional issues that you raised in your little clip. Thank you.
Okay. Professor Zuma, your comment, just in the last 30 seconds or so?
Right. You know, culture, I believe that culture changes with time. And also, any culture that puts us at risk of these infections, for example, and also any culture that goes against our constitution, our human rights, we need to really look at it. Working together, traditional leaders, these are all the issues that we can work together and make sure that those cultures that put people at risk, that go against our constitution, we need to really look at them and see whether are they still valid to be practiced.
All right, okay. Let's just stop it right here, just for a quick ad break, and when we come back, we will continue our discussion on prevention of HIV and AIDS. Please stay with us. Welcome back. If you just joined us, this is Health Talk, and we're discussing HIV/AIDS in South Africa. Now, on the subject, we now focus a little more on prevention, and we still have our three special guests now. Ladies and gentlemen, you know, we did say that there appears to be vulnerable groups insofar as HIV/AIDS, and one of the vulnerable groups is young females. Can we just focus our discussion in this segment on prevention strategies? Let me start with you, Ms. Nokwezi.
We need to ensure that we send correct, accurate information, educational information around the prevention of HIV, with the prevention methods that are available, such as male condoms and the female condoms that are available to our society.
Yeah.
And we should encourage young women to take responsibility of preventing the transmission of HIV. Although we know that a lot of young women and women are unable to negotiate condom use within their sexual relationships. However, these need to be available within our healthcare facilities, even in public, social public spaces.
We'll talk about condoms. How easily available are the female condoms?
Well, the female condoms, they are available within the public healthcare sectors. They're available in private pharmacies. However, we see less of a demand for the female condom due to the myths around it. And that increases the need for us to make sure that we educate our communities on the factual correct use of the female condom, and encourage women to, because if we are educating men to say, wherever you are, have a condom in your pocket, have a condom in your wallet, we should do the same to women, to say, have a male or a female condom, whichever one you prefer, and educate women on how to use it, and actually sensitize men on the female condom itself, because there are myths such as that it makes a lot of noise. I mean, if we are to say the female condom makes a lot of noise, sex is not quiet on its own. The sexual action, the sexual do is not a quiet practice that one does. So we need to educate more women and encourage women and men to go and demand and collect female condoms within our healthcare facilities.
Okay. Professor Zuma,
Yep.
Your comments.
Yes, it's true. What we need is to make sure that our young women are educated in the sense that they need to be aware of the risk, for example, that is involved in having sex at that early age, for example. For me, my focus would be to say we need to really look at the perpetrators, the people that put young women at risk of HIV infection. Yeah. The older men, for example. We can focus on young girls, but they are enticed into these issues.
We've seen the ones that we showed in that clip. I mean, they were very brave, to talk about these things. But how do we make sure that the message actually gets across to these people?
Well, one of the mistakes, for example, I heard in the clip, one gentleman said, I consider myself a sugar daddy. My question is, what is sugar about that relationship? Why do you refer to them as sugar daddies? They are not sugar daddies. Yeah. We need to call them who they are or what they are, for example. They are not sugar daddies. Yeah. They are something else. Yeah. And we need to educate our young women or young girls, for example, that if you look at what drives them into these relationships, it's things of, having a good life, in quote, if I may call it, but which my belief is that a good life would be for them in a classroom than in the streets or having good clothes and things like that out there. So that is the education that we need to promote. We need to show our young girls that actually there is a much better life without these people.
Okay. Dr. Abdullah, I mean, we've been saying some of these things for a number of years now. Are we just, talking to ourselves or talking across these people? How do we make sure that, the message actually gets through to people?
So my colleagues are absolutely right. We need to have good programs in schools, and we do have programs in schools. We need educational programs to explain to young women the risks of alcohol use. We know that often sex starts in a tavern where young women and men meet. The risk increases when you've had a drink or two, And then we also need these programs, like you had a clip from the Zazi campaign. We have good NGO programs like Soul City and Love Life. All of these programs need more resources. They need expansion. They need to be more effective. So there is quite a lot that we can do. But the kernel of it is this transactional sex, this intergenerational sex. And that's the thing that this country must get on top of by tackling both the issues that affect young women who get into these relationships and educate the men about behaving in a different way and doing things in a different way.
Is there any role that government can play in this regard?
Government is crucial, and we have made big investments in providing treatment. We need to make the same investments in providing funding for prevention programs. So government is central to this. And within the National AIDS Council, I know the Deputy President, the Minister of Health, they are all very concerned about the high rate of new infections. And there certainly are discussions within government to improve programs for basic education and information. In fact, just a few weeks ago, the Deputy President was asked in Parliament, what government is going to do about this. And he expressed in no uncertain terms that government is committed to tackling prevention in the same way in which we have tackled treatment.
Yeah. Well, I'm afraid, time is one thing that is very scarce, and we just don't have enough of it. I want to thank you very much, Dr. Farid Abdullah, for your contribution. Dr. Farid Abdullah, CEO of SANAC, and also our guest here in Johannesburg, Professor Kangalani Zuma from the HSRC, and Ms. Nokwezi Hoboy. All right, we need to go for an ad break, and when we come back, we wrap up and leave you with a take-home message on HIV and AIDS. Stay tuned. Welcome back. Now we wrap up our program, and we'll start with Professor Zuma. In 30 seconds, what are the main problems that we're facing insofar as HIV/AIDS transmission is concerned?
Well, it's the lack of education, promotion of prevention out there in the community. And I hope that going forward, media, for example, will go back and do a lot in educating people about HIV. And to the young people of South Africa, you're actually worth more than what puts you at risk of HIV infection.
Okay. Ms. Hoboy?
I'd like to encourage South Africans to start talking with adolescents about the transmission of HIV and the prevention of HIV, and encourage everyone to take care of themselves and protect themselves from contracting HIV.
Okay. All right. Well, remember that the HIV problem is a reality. It is still with us. Almost 25% of all new infections occur in young women. We can do much more as society to try and curb this disease, this scourge, and we must join hands as society to try to speak out against risky behavior such as multiple sexual partners, engaging in sex before the age of 15, and risky behavior such as intergenerational sex and so on. Unfortunately, that's all the time we've had for today. And it's on that note that we say goodbye to you. And remember that besides the YouTube streaming, you can catch us during our repeat slots at 2 p.m. and 10 p.m. every Saturday evening. And until next week, same time, It's a goodbye from me and the rest of the queue. Please do take care.